Well, welcome everybody to another segment of Lewis at Large. Yours truly, Warner Lewis from the flight deck, and of course that means some smart. Talk radio is in your future, and this segment, one of tremendous interest, I'm sure. We will be talking about the Ebola outbreak with someone that has seen it firsthand, Dr. Marida Stone. She is an international health expert. She has just returned recently from Liberia, working with the government at the epicenter of this deadly epidemic. She has quite a few credits and is well known as an international medical and public health expert with extensive experience at the executive levels in management, policy, and program development. She was instrumental in developing Liberia's first national health policy. She is also, on top of all that, an OBGYN. So, Dr. Stone, welcome. And how are you, my friend?
Thank you, and I'm fine. How are you?
Well, we're good. We're hope that you are fit and healthy with your return from Liberia. Tell us, if you would, and again, at the date of this recording, America has seen its first fatality as a result of this disease. But anyway, tell us what you found when you were over there.
Well, what I found in Liberia was a people that was very terrified. Everybody is scared, panicking. No one knows who has Ebola because it could be in your midst and you don't know it, and somebody could manifest symptoms the next day. So people are quite frightened. And, it's changing the cultural dynamics. There is no touching, no hugging, no shaking hands. And Liberians are very touchy-feely people. They are not able to touch each other. And that's really something that is disturbing to them. But what I found was that the response itself to Ebola was not well coordinated. We put systems in place in August to help to create some kind of a command over the national response. And basically what that entailed was setting up a case management system, a contact tracing system, the laboratory, the logistics, and the psychosocial aspects of the response. But in Liberia, you had a very high incidence of Ebola cases because of the three countries that are affected, Liberia, Sierra Leone, and Guinea. Liberia has the highest number of cases and actually double the number of cases in both Guinea and Sierra Leone combined. So you had increasing case fatalities. You also had people not listening to the public health messages that were being disseminated by the government. They were being told not to touch dead bodies. They were being told not to bury the dead because the dead bodies are equally infectious as the live infected person. But, because of the culture and tradition, they were not listening to the public health messages, and they were adhering to the practices of the traditional rituals, which increased the incidence of infection because they were preparing the dead for burial. And so those are some of the things that I found in Liberia.
Dr. Stone, again, we're very pleased to have you here. Would you share with our listeners, tell us the essence of this disease? What do we know about it, and how does it affect the body?
Well, Ebola was named after the Ebola River in the Democratic Republic of Congo, which used to be called Zaire back in 1976. And at that time, it was found in forest areas, in very rural areas that were sparsely populated, where people literally lived with animals. And, a group of people began manifesting symptoms of vomiting, severe headache and perspiration, bleeding from every orifice. And they were dying very quickly. And anyone who came into contact with them was infected, and the case fatality rate was about 90%. So if you came in contact with an Ebola-infected person or an animal that was perceived to be transmitting the virus, you died almost. It was almost a death sentence to come to be infected. So what is different about Ebola in West Africa is that instead of being in forest areas, it has spread to the urban centers. It has spread to cities and towns that are densely populated. And, where you have issues of sanitation and migration of the population, the transmission is greater in these areas. For example, Liberia has a population of 4 million plus people. And in Monrovia, the capital city and its environs, its metropolitan area, you have about 2 million people. And in as of 2 days ago, almost 4,000 cases of Ebola occur in that area, in Liberia alone. That is double what has occurred in Sierra Leone. So you have it increasing exponentially, and it's predicted that every 3 weeks or so, the case fatality rates double, or the cases that are new cases will double. And so people are very terrified, especially in Liberia. They seem to be having a handle on it. They seem to be able to control it better in Guinea and Sierra Leone, perhaps because they have more aggressive public health mechanisms in place than they have in Liberia.
You're listening to Lewis at Large. Yours truly, Warner Lewis from the Flight Deck here, and talking to Dr. Marida Stone. She is an international health expert who's just returned from Liberia, working with the government at the epicenter of the Ebola outbreak. She is also well recognized in a variety of health areas around the world, particularly in health management policy and program development. She's also instrumental in developing Liberia's first national health policy. We won't be able to answer every question here, Dr. Stone, but one of the things I would like to get some facts out. For example, and particularly in the Western world, in the United States, tell us, can we catch? Is it possible that this disease can be spread simply riding on a commercial jetliner with someone who has the disease? Is that possible?
Not unless you're exposed directly to their body fluids. For example, sweat is infectious. So if somebody is sweating profusely and their clothing is drenched in sweat, and you're in contact with that, that is a source of transmission. That is a source of infection, because Ebola is transmitted from human to human through direct exposure to the bodily fluids. That is the sweat, the vomitus, the urine, feces if they have diarrhea. Semen is infectious. So for somebody who is incubating the virus over, you don't know that they're incubating the virus, and until they start manifesting symptoms, they are not infectious. So
does everyone
incubation?
I'm sorry to interrupt. Go ahead. Go. Okay. Does everyone that incubates, is used to everyone that has the virus, will they eventually show symptoms, or do we know that?
Well, we assume that once exposed, and if you, depending on your own immune response, if you incubate the virus, the incubation period is from 2 to 21 days. However, most people who manifest symptoms after exposure do that within the first 2 to 8 or 2 to 10 days. So if you're going to get sick, you will get sick within the first 10 days, let's say. However, there have been people who have manifested symptoms as far along as 21 days, and that is the reason to be cautious. The incubation period is extended to include the full 21 days. Now, will you catch Ebola just by sitting next to being in an airplane with somebody who is incubating the virus? Not likely, because until they are symptomatic and you are exposed to whatever their symptoms are, their sweat, their vomitus, their urine, their, whatever it is, their bodily fluids, they do not transmit Ebola to you. So you cannot just be on an airplane with somebody sitting somewhere incubating a virus and become infected.
What about, and again, the facts as you know them, and again, if this show is being produced in the middle of October of 2014, where has the disease spread to? Is it heading in necessarily certain directions, or is there any rhyme or reason to the spread of it?
Well, first of all, the epidemic is in Guinea, Sierra Leone, and Liberia in West Africa. It is worse in Liberia. Now, the two international incidents that have occurred where the disease has been transmitted to another country, it has happened when individuals have left Liberia, and one went to Nigeria, but he was actually manifesting symptoms on an airplane. Before he got on the airplane, he knew that he had been exposed directly to Ebola because his sister had died of Ebola. And he had actually taken his sister to the hospital and had been in contact with her blood and body fluids. So he knew that he was infectious because he had been tested. And while waiting for the test results, he got on an airplane and went and got to Nigeria and collapsed. And that was the first case of transmission outside of Liberia. The second one is the most recent one of Tom Duncan that happened in Dallas, Texas recently. Now, Mr. Duncan did take care of or handle or transport someone who was infected with Ebola. Apparently, at the time that he was assisting the family to transport her to the hospital, he did not know that she had Ebola. So, he lifted her out of the house, put her in the car, took her from place to place, but not realizing that she had Ebola. When he left Liberia, obviously, and she died 5 days before he left Liberia. When he left Liberia, he had no symptoms. He was screened at the airport. It is after he arrived in the United States, several days after he arrived in the United States, that he began to manifest symptoms. And so, he was incubating the virus, not symptomatic, and therefore not infectious during his travel from Liberia and arrival in the United States. Now, will the epidemic spread throughout the United States? Very unlikely. It is highly, highly unlikely for several reasons. Number one, you have the infrastructure in place. You have the health professionals in place. You have the infectious disease specialists in place. You have medical centers that have isolation units that are trained to handle disasters, and that can respond. So the likelihood of you having an epidemic of the magnitude that is in West Africa, or even an epidemic for that matter, is highly unlikely.
Is there anything that we can learn, or that maybe we have learned from the AIDS epidemic, that when everything exploded to the forefront in the mid-'80s, are there any correlations there in terms of its spread or its education or its containment?
Well, there is a difference because the AIDS epidemic was sexually transmitted and transmitted through blood products. But it was not a lethal, it was not almost an immediately lethal disease as Ebola is. And, the incubation period for AIDS was variable. People 3 months or longer you could have been exposed before you manifested symptoms. And the symptoms were not so overtly contagious like Ebola is. And so with HIV, there were certain populations initially that were infected, the homosexual populations. And unless you were engaged in that lifestyle or had been exposed to the blood or bodily fluids of somebody who was infected, you were not likely to be walking down the street or sitting on an airplane next to someone with AIDS and become infected. Ebola is different in the fact that it is lethal, it is highly contagious, and the instant you are exposed to someone's bodily fluids or blood, you stop this incubation period, you can become infected very quickly, and you die. Until recently, the case fatality rate was 90%. Now, with this recent epidemic in Liberia in particular, the case fatality rate is about 56 to 60% because people have been surviving. And what they have found is that if you get to a treatment center early on when you're manifesting symptoms, your chances of survival are much greater. Now, There is no treatment or no cure for Ebola per se. However, the treatment is individualized because you treat the symptoms. If someone is sweating profusely, high temperature, that's what you treat. If they are vomiting, you treat that. If they have diarrhea, you treat that. Whatever the symptoms are, and then you hydrate them. Those are the critical things in controlling at least in caring for someone who is manifesting Ebola symptoms. Talking about containment, the difference with HIV is that, and Ebola is that with Ebola, people who come in contact with someone who is infected or an animal that is infected have to be monitored for 21 days because they can be incubating the virus and become infectious at any point along that spectrum of those 21 days. So containment has to do with recognizing when you have symptoms, reporting yourself to a treatment unit so that you'll be immediately isolated. And then everybody with whom you have come in contact should be traced. And that is what they call contact tracing. It is one of the critical elements of containment of the virus.
Do you, what's your, and again, I know we're early on into this, but from your professional opinion, your observation, the research you've done, all the traveling and the contact that you have had, how do you see, how does this play itself out, or are we just way too early to have any idea?
Well, there are all kinds of projections from WHO, from the CDC and all of that. But I think that to contain Ebola and prevent transmission, a lot has to be done at the source. It has to be done in Liberia in particular. The Guineans seem to have a better handle of dealing with the transmission rate because they have a very strict contact tracing mechanism in place. The Sierra Leoneans locked down the country for several days and went from house to house tracking people who may be ill, in order to find infected individuals in their society. So they have been a lot more aggressive about tracing people as a means of containing and preventing transmission. In Liberia, you have several situations at play. Number one, people insist on adhering to traditional practices that are not good for them. For example, they're being told not to bury the dead. And any person who dies, any dead, is considered to have died of Ebola until proven otherwise, because you have 70 to 80% of the dead that have been tested. They do a swab testing. They put a special swab into the mouth of the dead person, and they take the secretions from there and test it. And 70 to 80% of those people tested have tested positive for Ebola. So people are told, don't touch the dead and do not bury the dead. But because in certain traditional societies, it is a ritual. People touch, they bathe, they wash the dead in a special way. They wash their faces in the water that the dead have been washed in. Some people even wash children and spouses in the water that the dead have been washed in. And this is still continuing in Liberia. So you have just, 2 weekends ago, 5 members of one family died simply because they went to prepare some dead relative for burial. They are not listening, and they are not listening to what the public health messages are. And if they're listening, they're ignoring them. That's a critical reason why Ebola is escalating in Liberia. The other thing is because people are moving. There's a lot of migration. They're being told that if you've come in contact with someone who has Ebola or someone who has died of Ebola or have attended the funeral of someone who has died of Ebola, you need to isolate yourself, not in a hospital facility, but in your home. Monitor yourself for 21 days. Report to the health authorities that you have been exposed. And they will put you on this list of contacts and follow you for the 21 days so that if at any point you begin to manifest symptoms, you are removed from that environment and taken to a treatment center where you are then tested and given the appropriate care.
Again, we're talking to Dr. Marida Stone, international health expert, who has just returned from Liberia, working with that government specifically on the Ebola outbreak. Dr. Stone, is the priority now research on a cure or at least a vaccine of some kind, or is it just simply on education and trying just to functionally contain the disease where it is now?
It's a combination of all those things. However, the immediate priority is to contain the disease and thereby prevent transmission. Because unless you contain it, transmission will spread. And as you've seen, it's possible to have someone get on an airplane, arrive in a country, whether it's in Europe or America, and, while they're incubating this virus, and become infected and thereby become a source of transmission. So you have to contain it. Containment is a priority in preventing transmission. There's research going on for development of a vaccine. And from talking to health officials in Liberia yesterday, I understand that they will be doing a vaccine trial in Liberia. It's supposed to be implemented sometime soon. Of course, there are pharmaceutical companies that are in the process of, they're in the process of developing drugs that would be used to treat Ebola. But what they have available right now is very complicated because, for example, this ZMapp, this experimental drug that was used to treat Ken Brantley and the other American who became ill in Liberia and were airlifted back to the States. ZMapp is experimental. Now, we don't know whether ZMapp alone is responsible for the recovery of Ken Brantley and the others. What we do know that the preparation of ZMapp from the preparation process to market is a long, complicated one because the antigen itself is injected into a tobacco plant. And, so it has to be cultivated, and it takes about 3 months from the beginning till you have a product. And so ZMapp is not readily available, is not produced in mass supplies because of the process of its development. The other drug, for example, the Brincidofovir, which was used on Mr. Duncan in Dallas, Texas, is an experimental antiviral drug. So everything is experimental, and so unless you have a high enough sample population that you try this on, you really don't know the extent, the efficacy of it, because it's still experimental.
Well, it is a subject that certainly has captured the attention of the entire world, Ebola outbreak, and we've been talking to Dr. Marida Stone, again, an international health expert who has just returned recently from Liberia, working directly with the government on all issues Ebola. Dr. Stone, before we kind of head out here, I would like to ask you two questions, actually. Number one, what should our listeners be thinking about, or what should be a thought you'd like to leave them with regarding this entire situation, again, as it stands in the middle of October 2014? And is there a website or a place where people can go to find out just the real facts about what's going on?
Well, first of all, the American public needs to know that it is highly unlikely that Ebola will become an epidemic in this country. Highly, highly unlikely. Because you have the systems in place, you have the infrastructure, you have the resources, you have the trained personnel, you have the supplies, and you have the public health awareness campaign spearheaded by the Centers for Disease Control. The Centers for Disease Control has put certain guidelines in place. Hospitals are being prepared. They're doing simulations of Ebola response in different facilities. I know they did that in Boston. They did it in New York. So all of these facilities are prepared. Most recently, the government, the U.S. government, instituted this screening program at 5 airports: Atlanta Airport, JFK Airport in New York, Newark Airport, Dallas, Washington in Washington, D.C., and the O'Hare Airport in Chicago. The screening begins in JFK on Saturday. And then the other airports will follow shortly thereafter. And, so you can screen people even when they're in the incubation period. If they're not manifesting symptoms, they're not infectious, and you cannot isolate them when they're not infectious. You can suggest to them that if they have come from one of the epidemic countries, that they should monitor themselves for 21 days, and if at any point they begin to have symptoms, report to a health facility that is on high alert. Because especially after this incident in Dallas, Texas, where Mr. Duncan showed up with symptoms and was sent home on antibiotics because the people there either were not aware or they were not thinking or they didn't see the red flag that he came from Liberia and he has these symptoms because it's all new to them. So people are now aware after Tom Duncan's incident in Dallas. And you should not be afraid. You shouldn't panic all over the place because you're not likely to come in contact with an Ebola-infected person. And therefore, you're not going to just catch Ebola by walking down the street or sitting in a plane or sitting next to somebody on a bus. It is not going to happen. You can go to the Centers for Disease website. They have all the guidelines there. They have a whole package of information that you can read up on. And, there's so many other websites that are also disseminating information. So educate yourself. Be informed about what Ebola is, how it is manifested, how it is transmitted. And then I think if you do that, you will be more aware and less likely to be terrified as many people are at this moment.
Well, I appreciate your time and the facts that you have shared with us. Again, we've been talking to Dr. Marida Stone, international health expert. We've been talking about the Ebola outbreak. Facts as we know them as of now. And thank you again so much and best of luck in your work.
You're welcome. And thank you so much for the interview.
You bet. We'll be back with more right after this on Lewis at Large.